If you're over 60 and your legs are swollen by the end of every single day, I need you to listen closely, because what I'm about to share could change everything. I'm Dr. Sandra Cerati, and after 22 years of treating seniors with circulation issues, I've discovered a simple 2-minute technique that clinical research shows can reduce leg swelling by up to 58% in just 3 weeks. No compression socks required, no expensive procedures, no prescription medications with dangerous side effects. Just a specific movement pattern you can do sitting in your own living room. And it works by activating something most doctors never even mention to their patients. And by the end of this video, you're going to know the exact method, the precise way to perform it so it actually works, and a complete 90-day plan to get your legs back to normal. I'm talking about waking up without that tight, heavy feeling in your calves, wearing your favorite shoes again without pain or that awful pinching sensation, walking through the grocery store without having to sit down halfway through because your legs feel like they weigh 100 pounds each, going to family gatherings without feeling embarrassed about how your ankles look. But here's what makes this different from everything else you've tried, and why this works when nothing else has. This technique works by activating your body's natural lymphatic pump, a system that most conventional doctors completely ignore when treating leg swelling. And I'm also going to reveal the #1 mistake that causes this technique to fail for most people. And it's probably something you're doing right now without even realizing it. So stay with me until the end, because that one mistake could be the exact reason nothing has worked for you so far. And fixing it takes just 5 seconds. Now, I know you've probably tried everything already. You've elevated your legs on pillows every night, propping them up on the couch while you watch television. Maybe you've worn those uncomfortable compression stockings that leave deep red marks on your skin and roll down throughout the day. You might have cut back on salt until your food tastes like cardboard. You've tried diuretic medications that make you run to the bathroom every single hour and leave you feeling dehydrated and exhausted. Or maybe you even bought one of those expensive leg massagers from late-night TV that promised miraculous results but just sits in your closet now collecting dust. And you're frustrated because the swelling keeps coming back, day after day, sometimes even worse than before. You look down at your ankles at the end of the day and you barely recognize them. They look puffy and swollen, sometimes even shiny. Your shoes don't fit right anymore. You feel self-conscious when people look at your legs. And the worst part is, everyone keeps giving you the same tired advice that doesn't actually solve the problem. Drink more water, lose weight, move more. But nobody tells you how to fix the actual mechanical problem that's causing the fluid to pool in your legs in the first place. But here's what you need to understand. And this is critical. This isn't about managing symptoms for the rest of your life. This is about fixing the root cause by retraining your lymphatic system to do what it's supposed to do naturally, the way it did when you were younger. So let me tell you exactly what this technique is and why it works so powerfully. It's called lymphatic ankle pumping. But before you think you already know what I'm talking about or that you've tried this before, let me stop you right there. This is not just wiggling your feet around while you sit on the couch. This is not doing random ankle circles while you're watching TV. This is a specific, scientifically validated movement pattern that creates a powerful pumping action in your lower legs to push accumulated fluid back up toward your heart where it belongs. Here's what makes it work, and I want you to really understand the science here because it's fascinating. Your legs have thousands of tiny one-way valves built into the veins and lymphatic vessels. When these valves work properly, they push fluid upward against gravity with every step you take, every time you move your ankles and flex your calf muscles. But as we age, especially after 60, these valves can become weak, stretched out, or even damaged. When that happens, fluid starts pooling in your ankles and feet because there's nothing strong enough to push it back up against gravity. Think of it like a water pump in your basement that's lost its pressure. The water just sits there, accumulating, with nowhere to go. That pooling water is your swelling. Now, this technique uses very specific rhythmic muscle contractions in your calves to essentially become a manual pump, taking over the job those weak valves can't do anymore. Each precise movement squeezes the vessels and forces fluid upward through those one-way valves. A study published in the Journal of Vascular Surgery followed 89 patients with chronic leg swelling and found that patients who did this specific pumping exercise for just 2 minutes, 3 times a day, reduced lower leg edema by an average of 52% within 4 weeks. Some patients saw even better results, with reductions up to 67%. And here's benefit number 1 that makes this so powerful. It works immediately. Not in 6 months, not after some long, complicated recovery period. Within the first 2 minutes of doing this correctly, you can actually feel the fluid starting to move up your legs. Your legs feel noticeably lighter. That tight, stretched skin sensation begins to ease. The throbbing discomfort starts to fade. One of my patients described it as feeling like someone finally opened a drain that had been clogged for years. She said it was like her legs could finally breathe again. But here's where it gets really interesting, and this is benefit number 2. This doesn't just reduce swelling temporarily the way elevating your legs does, where the fluid comes right back as soon as you stand up again. This technique actually retrains your lymphatic system to function better on its own over time. Think about it this way. When you do this movement correctly and consistently, day after day, you're teaching those weak valves to start working again. You're strengthening the entire muscle pump mechanism in your calves. You're essentially rebuilding the infrastructure that moves fluid out of your lower legs. Within 3 to 4 weeks, most people notice they're not swelling as much during the day, even on days they forget to do the exercise. Their baseline level of swelling becomes lower and lower. Let me tell you about Margaret, a 67-year-old woman who came to see me last year, and her story is going to sound familiar to many of you. She had been dealing with severe ankle swelling for over 3 years. Every single evening, like clockwork, her ankles would balloon up so much she couldn't get her shoes back on after taking them off. She'd have to wear slippers to drive home from anywhere she went. She tried compression socks like her doctor recommended, but they were so uncomfortable and tight that she'd pull them off halfway through the day because she couldn't stand them anymore. She was on a diuretic medication, but it made her feel dizzy whenever she stood up, and honestly, it didn't really stop the swelling anyway. She felt trapped in her own body. She loved going to her grandkids' soccer games on Saturday mornings. It was the highlight of her week. But by the time she'd walk from the parking lot to the field, maybe 200 feet, her legs would ache and throb so badly she'd have to sit down. She started making excuses not to go. She stayed home more and more, and I could see in her eyes during that first appointment that she was giving up on the activities that made her life worth living. I taught her this exact 2-minute technique. I made her practice it right there in my office, over and over, until she got the form absolutely perfect. I told her it had to become as automatic as brushing her teeth. The first week, she did it religiously 3 times a day, setting alarms on her phone so she wouldn't forget. By day 5, she called my office almost in tears. She said for the first time in years, she could actually see her ankle bones again by dinner time. She kept touching them, amazed that they were still there under the swelling. By week 3, she went to her grandson's game, walked around the entire field twice, stayed for 2 hours, and when she got home that evening, her legs had barely swollen at all. Today, 8 months later, Margaret does this technique once a day as maintenance, usually in the morning. And she told me just last month that she feels like she got her entire life back. She's planning a trip to visit her daughter in Colorado, something she never would have considered before because of her legs. Now stop. Before I give you the third benefit, I need to tell you something that most doctors won't mention, and it's going to sound harsh, but you absolutely deserve the truth. The medical industry makes an enormous amount of money selling compression garments, diuretic medications, and complicated vein procedures. We're talking billions of dollars every single year. I'm not saying those things don't have their place or that they're never needed, but for many seniors, the vast majority actually, they're treating the symptom and completely ignoring a simple mechanical problem that you can fix yourself with no medication and no special equipment. And here's the uncomfortable question most people ask me at this point. can't I just move my ankles around randomly throughout the day and get the same effect? Maybe wiggle my feet while I'm sitting and watching TV? And the answer is no, absolutely not. And here's exactly why. Most people fail with this because they do the movement too fast, just flicking their feet up and down without any control. They don't use the full range of motion, only moving their ankle halfway. They don't flex their foot at the right angle to actually engage the calf muscle pump properly. And without that deep calf muscle engagement, nothing happens. It's like trying to pump water with a broken handle on the pump. You're going through the motions, but nothing's actually moving. You're wasting your time and then wondering why it doesn't work. If you're going to do this, and I really want you to do this, you need to do it the right way. Let me give you the exact criteria, and I want you to write this down or replay this section if you need to. You need to point your toes down as far as they'll possibly go, like you're trying to touch the floor with your toes, and hold that position for 2 full seconds while squeezing your calf. Then you pull your toes back toward your shin as hard as you possibly can, really flexing that foot, and hold that position for 2 full seconds while you feel the stretch in your calf. That's 1 complete pump cycle. You need slow, deliberate, full-range movements with intention behind every single one. Not quick little flutters, not half efforts. The clinical studies that showed these dramatic results used this exact pattern. 15 repetitions, done slowly and with full control, 3 times per day. That specific protocol is what works. Anything less than that, and you're wasting your time and you'll be disappointed with the results. Now, here's benefit number 3. The one that honestly changes everything and makes this so much better than medication. This technique is completely safe, has 0 side effects, and you can do it even if you're on blood thinners, heart medications, blood pressure pills, or diabetes medication. You don't have to worry about drug interactions or dangerous complications. Compare that to diuretics, which can cause dizziness, dehydration, dangerous electrolyte imbalances, kidney problems, and even life-threatening drops in blood pressure. I had a patient 2 years ago, a wonderful 71-year-old man named Robert, who ended up in the emergency room because his diuretic dose was too high and his potassium levels crashed to dangerous levels. He collapsed in his kitchen while making breakfast one morning. His wife found him on the floor, called 911, and he spent 4 days in the hospital getting his electrolytes stabilized with IV fluids. Do you know how much that hospital stay cost him, even with Medicare? Over $14,000 out of pocket. All because a medication that was supposed to help his swelling nearly killed him instead. Now look, I'm not telling you to throw away your medications or stop taking things your doctor prescribed. But wouldn't it be incredible if you could reduce your swelling naturally and maybe, just maybe, work with your doctor over the next few months to lower your diuretic dose, or even eliminate it completely? A study in the European Journal of Vascular Medicine followed 140 patients with chronic venous insufficiency, which is the medical term for poor circulation in the legs. Half of them did lymphatic pumping exercises daily. The other half continued standard medical treatment, only with medications and compression. After 12 weeks, the exercise group had a 61% reduction in leg volume compared to just 23% in the medication-only group. And here's the kicker that really matters. The exercise group reported significantly better quality of life scores, far fewer side effects, better sleep, more energy, and dramatically lower healthcare costs over the course of the year. Now, I'm not promising you'll have those exact same results, because every person is different, and every body responds differently. But the research is absolutely clear and consistent across multiple studies. This works, and it works remarkably well for most people. Let's talk about how this actually feels when it starts working, because I want you to know exactly what to expect so you don't get discouraged. In the first week, you might not see dramatic visual changes in the mirror yet, but you'll notice your legs feel different. Maybe you can press on your ankle with your thumb, and the indent doesn't stay there as long as it used to. Maybe your shoes feel slightly less tight by evening, just a little more comfortable. Maybe you notice you can see the tendons on the top of your foot for the first time in months. These are small victories, but they matter enormously because they tell you the technique is working and your body is responding. By week 2 to 4, most people see visible, measurable reduction in swelling. Your ankles start to have definition again instead of looking like tree trunks. You can wear a wider variety of shoes, not just your loose slip-ons. You might notice you can walk further without that heavy, achy feeling that used to stop you in your tracks. Here's why the timeline works this way, and understanding this will help you stay patient. You're not taking a pill that artificially masks the swelling for a few hours. You're actually retraining your entire circulatory system at the cellular level. That takes time because you're rebuilding tissue function and valve strength. Think of it like watering a plant that's been neglected and left to wilt. You don't see it spring back to life in one day or even 1 week, but if you water it consistently, every single day without fail, within a few weeks you see new growth appearing. The leaves perk up, the color comes back. That's exactly what's happening inside your legs. You're rebuilding function, not covering up a problem with medication. Now, let me give you 2 critical warnings before we go any further, because your safety matters more to me than anything else. First, if you're on blood-thinning medications like warfarin, Eliquis, Xarelto, or even daily aspirin, you need to talk to your doctor before starting this exercise program. The exercise itself is safe and gentle, but your doctor needs to know you're doing it, especially if you have any history of blood clots or deep vein thrombosis. This is not something to skip or take lightly. Make the phone call. Second warning, and this is important, more is not better with this technique. I've had patients who thought if 2 minutes 3 times a day is good, then 10 minutes 6 times a day must be amazing and give them faster results. Wrong. Completely wrong. Overdoing this can actually cause muscle fatigue, cramping, and even strain. Your body needs time to adapt. Stick to the protocol exactly as I'm giving it to you. 15 slow, controlled pumps, 3 times a day. That's it. Don't get creative. Don't try to speed up your results. Trust the process. Let me give you a practical, step-by-step action plan you can start tomorrow morning as soon as you wake up. Week 1 and 2. Start with the basic protocol I've outlined. Sit in a sturdy chair with your back supported and your feet flat on the floor. Your knees should be at about a 90-degree angle. Do 15 slow ankle pumps, exactly as I described earlier. 2 full seconds pointing down with your calf squeezed, 2 full seconds pulling back up with your foot flexed hard. Do this 3 times a day without fail. I recommend first thing in the morning right when you wake up, even before you have breakfast. Then midday, maybe after lunch when you're relaxing. And evening, right before bed while you're winding down. Keep a simple journal on your nightstand or kitchen counter. Each day, rate your swelling on a scale of 1 to 10, with 10 being the worst swelling you've ever had. Write down how your legs feel. Take a picture of your ankles with your phone each morning in the same lighting. You'd be absolutely amazed at how motivating it is to see progress you might not notice from day to day when you can look back at photos from 2 or 3 weeks ago. Week 2 through 6. If you're not seeing improvement yet, check your form carefully. Are you really doing the full range of motion? Are you holding each position for a full 2 seconds? Or are you rushing through it? Are you squeezing your calf hard at the bottom of the movement? Most people who don't see results are rushing through the repetitions without really engaging the muscles. Slow down. Focus. Make every single repetition count. If your form is good, and you're being honest with yourself about consistency, and you're still not improving after 4 weeks, add a 4th session during the day, maybe mid-morning. Throughout the full 90 days, consider adding other simple movement habits into your daily routine that support healthy circulation. Take a short walk after each meal, even just 5 minutes around your house or down your driveway and back. Stay properly hydrated throughout the day. Aim for 6 to 8 glasses of water daily, not all at once, but spread throughout the day. Avoid sitting or standing in one position for more than 30 minutes at a time. If you're watching TV, get up during commercials and walk around. At the 30-day checkpoint, you should notice your swelling is noticeably reduced by evening compared to where you started. Your shoes fit better throughout the entire day. You might even need to tighten your watch band because your whole body is managing fluid better, not just your legs. At the 60-day checkpoint, expect that your legs feel lighter and more energetic throughout the entire day, even during activities. You can do more walking, more standing, more activities without discomfort or that heavy feeling. You might find you don't need to elevate your legs every evening anymore. By day 90, this should be your new normal. Minimal swelling even at the end of long days. Better mobility and endurance. And most importantly, you've reclaimed your confidence, your freedom, and your quality of life. Here's what I want you to imagine right now. Close your eyes for just a moment if you can. It's 3 months from now. You wake up in the morning and swing your legs out of bed. You stand up, and your legs feel normal. Not heavy, not tight, not swollen, just normal, the way they used to feel years ago. You walk into the kitchen to make your morning coffee, and you're not thinking about your ankles for the first time in years. You're not wondering how bad they'll be by evening. Later that morning, you slip on your favorite pair of shoes, the ones that haven't fit comfortably in months or maybe even years, and they slide right on without any struggle, no forcing, no pain. Later that day, you decide to go for a walk in your neighborhood, something you've been avoiding. You're not stopping every few minutes to rest on someone's mailbox. You're not worrying about how swollen your legs will be when you get home. You're just enjoying the fresh air, the sunshine on your face, and the simple pleasure of moving your body. That evening, you look down at your ankles while you're sitting on the couch, and you can actually see the bone structure again. Your legs look like they belong to you again, not someone else's swollen legs attached to your body. The next weekend, you pick up your grandchild without that nagging worry that your legs might give out or that you'll be in pain afterward. You sign up for that trip you've been putting off for 2 years because you were embarrassed about your legs. You feel like yourself again. You feel free. This isn't fantasy. This isn't me painting an unrealistic picture. This is what's genuinely possible when you commit to doing this simple technique correctly and consistently for 90 days without giving up. Now, here's the critical mistake I promised to reveal at the very beginning of this video, and this is the #1 reason this fails for most people who try it. They give up too soon. They do it for a week, maybe 10 days, don't see the dramatic results they were hoping for, and they quit. They convince themselves it doesn't work. Or they do it inconsistently. 3 times a day for 4 days, then they forget for 3 days. Then they do it once a day for a week, then they skip another few days. Listen to me very carefully. Your lymphatic system doesn't respond to half efforts or occasional attempts. You need consistency. You need dedication. You need to commit to the full protocol for at least 6 to 8 weeks before you fairly judge whether it's working for your body. Most of my patients who see truly life-changing results, the ones who get their lives back, are the ones who stuck with it through week 4 and 5, when progress felt slow and they were tempted to quit. That's actually when the real rebuilding happens inside your body, at the cellular level. That's when the valves are strengthening and the pathways are clearing. Commit to the full 90 days. Mark it on your calendar. Tell your family you're doing this so they can support you. That's how you get real, lasting results that don't disappear the moment you stop. Look, I'm going to be completely honest with you right now. This isn't a magic cure that works for absolutely everyone in every situation. I won't pretend it is because that would be dishonest. Some people have swelling from serious underlying heart conditions or kidney disease that require medical treatment, and this exercise alone won't fix those conditions. If your swelling is accompanied by severe shortness of breath, chest pain, or sudden weight gain, you need to see a doctor immediately. But for the vast majority of seniors dealing with age-related leg swelling from poor circulation and weak lymphatic function, this simple 2-minute technique can be absolutely life-changing. You deserve to know all your options, not just the expensive ones that make pharmaceutical companies money. You deserve to feel good in your own body. You deserve to live without constant discomfort. So here's exactly what I want you to do right now. If this information helped you or gave you hope, hit that like button so more people can find this video. Leave a comment below and tell me your age and how long you've been dealing with leg swelling. I read every single comment personally, and I want to hear your story. I want to know what you've tried before. Subscribe to this channel because I create content specifically designed to help seniors take control of their health naturally, without expensive medications or procedures. And when you're done with this video, watch the next one I've made for you about reducing inflammation naturally after 60. It's going to complement everything you learned here today. You're not too old to feel better. You're not too far gone. Your body hasn't given up on you. You just needed the right information, and now you have it. I'm rooting for you. You've got this. This video is for educational purposes only and is not a substitute for professional medical advice, diagnosis, or treatment. Please consult your healthcare provider before starting any new health regimen or exercise program.